Hi, I'm Bernardo Mora, MD, Medical Director for Behavioral Health and Recovery Services, BHRS. I first wanted to remind you to check out the other videos in this series, tips from my colleagues Steve Collins, Manuel Rivera, and Camille Casey. Just go to the BHRS website, it's stancounty.com/BHRS, and look for the COVID-19 videos, and there'll be a link also provided on this page. I want to share with you a few words of advice as we all try to cope during this extraordinary time when all of our routines have been changed, disrupted, and there's a lot of worry among all of us as we navigate through this pandemic. Yes, even a psychiatrist can worry, and while you might be concerned, and you should be concerned with your own health and wellness, don't forget it's also okay and normal to worry a little bit about everyone else too. So one way to reduce worry, information overload is real and can contribute to worry and anxiety. So stop watching the news. Well, maybe not cold turkey, but for example, maybe just limit it to 1 hour a day, a half an hour in the morning, a half an hour in the evening. Just try to distract yourself intentionally also away from the news to even work or recreation. You are allowed to have fun even during a pandemic. Reach out to your friends, to your family, to your healthcare providers. Did you know that you and I are actually making more telephone calls lately? That's just the natural sort of outgrowth of not having as much contact, physical contact with everybody. Staying in touch helps for distraction and for diversion, and also helps in this extraordinary time to manage your feelings, your sense of worry, of being in this alone, and of being isolated. If you are in counseling and or you have a prescriber, you see someone for medication, a doctor, a nurse practitioner, or a physician's assistant, please keep in touch with them. For any kind of medication, whether it's medical or psychiatric, call them, especially if it's been a while since you've been in contact with them. And most counselors and prescribers are still available now, even if it's by telephone or video chat rather than in person. If you're running out of your medication, definitely call your prescriber's office and try to call at least a week in advance so that there's enough time so you can get your refill on time. If you need help getting that prescription, for example, you have trouble, you can't travel to the pharmacy easily, tell your prescriber that also so that they may be able to find a way, even if it's temporary, to be able to get you your medication on time. As part of our mental health awareness campaign, we at BHRS want to remind you that Stanislaus County believes each mind matters. For more health and wellness information, or if you are in crisis and you need support, please call 211. That's 211. We're here to help. I hope that this advice is useful to you during this pandemic and in the future as well. Please stay safe.